Pop quiz: can you tell the difference between psoriasis and eczema? As if these chronic skin issues weren't frustrating enough, they can also be incredibly confusing. Both eczema and psoriasis cause red, scaly areas on the skin, and to the untrained eye, they can look similar. Board-certified dermatologist Alan J. Parks, MD, tells Self. Here's how to figure out which is which, along with the best ways to actually treat these annoying skin conditions. These are the most common psoriasis symptoms. The most common type of psoriasis is plaque psoriasis, per the Mayo Clinic. The symptoms of plaque psoriasis are most often found on the scalp, elbows, knees, lower back, and genitals and may include raised, red patches of skin, a silvery white coating of dead skin cells on top of those patches, itchiness, pain, cracking skin and bleeding. Eczema symptoms, on the other hand, are similar but different. Eczema is really the collective name for a group of conditions that cause the skin to become red, itchy, and inflamed. The most common form of eczema is atopic dermatitis, which is why when most people say eczema, they usually mean atopic dermatitis. Todd Minars, MD, an assistant clinical professor of dermatology at University of Miami School of Medicine, tells Self. Eczema is much more common than psoriasis. According to the most recent estimate available, more than 30 million Americans have some form of eczema. A textbook case of eczema begins during infancy or early childhood, Dr. Minars says. There are some controversies as to whether eczema is primarily an immune-mediated disease or a skin barrier defect disease, Dr. Wu says. Like psoriasis, it also tends to run in families, suggesting that there may also be a hereditary component. Can stress exacerbate psoriasis or eczema? There's no doubt that living with psoriasis and eczema can be stressful, and their connection to stress has been widely discussed in the dermatology community. Although experts often advise people with psoriasis and eczema to avoid stressful situations, a lot remains to be proven about exactly how stress can influence these conditions. A November 2017 meta-analysis in the British Journal of Dermatology evaluated 39 studies with more than 32,500 patients, concluding that no convincing evidence exists that preceding stress is strongly associated with psoriasis exacerbation, onset. As for eczema, an October 2017 study in the International Journal of Molecular Sciences reported that psychological stress may exacerbate atopic dermatitis, and it might be mediated by the hypothalamic pituitary adrenal (HPA) axis. Just because science hasn't fully clarified the role stress plays in these conditions doesn't mean the link doesn't exist. Dr. Wu says he's seen patients experience stress-related psoriasis or eczema flare-ups in the past, and the ad mentions stress when discussing both psoriasis and eczema. Though psoriasis and eczema are different conditions, treatment for the two is often similar. While there's no cure for either condition, they can be treated. If you're diagnosed with psoriasis or eczema, your doctor may recommend over-the-counter moisturizers, tropical medications to reduce inflammation, like corticosteroids, calcineurin inhibitors, and retinoids, oral steroids, like prednisone, which can help calm a severe case when used for a short period of time. Wet dressings, which involve wrapping the area with a wet bandage to soothe the itchiness. Phototherapy, in which a special machine emits ultraviolet light onto the skin to help reduce itching and inflammation. Although psoriasis and eczema are both frustrating, irritating conditions, they shouldn't be life-ruiners. If you're struggling with managing your psoriasis or eczema, see a dermatologist, who can help determine the best treatment plan for you. Thank you.